Good day. This is Dr. Anasuya Jagadevi Jagadisan. Now, when we look at how we approach mental health nowadays, a lot of practitioners learn Corey and Corey, Introduction to Counseling, Counseling Theories from that book that has summarized version of therapeutic modalities, and then go out there and practice and then come back and say, I don't know what I'm doing. How am I applying this correctly? Because you're only learning a summarized version of a modality. In order to be professional, in order to call yourself a professional counselor, you should be able to, identify what, where, why you use certain approaches, how your theoretical framework, how your philosophy fits into what you're using as therapy. I have two modalities. The first one is CTRT, choice theory reality therapy, and the second one is insight-based therapy. Both of which I'll be offering training this year. Now, even if you don't take training with me, please go and make sure you get trained as a professional. Basic level, which is what I'm offering in January and February, is basic. So anybody can take it, whether you are a practitioner or you are a client who wants to learn a little bit more about CTRT so that you are able to understand and apply it in your life and even help your family with understanding of CTRT. Because choice theory is a powerful tool that addresses issues of freedom, of power, of the dynamics in a relationship that help you navigate these things a little bit more easily, a little bit more coherently, and understand how yourself and those around you make choices and make decisions that sometimes don't seem to align with their own goals or the goals of the family or what's going on. So getting training in a modality is really important. Now, honestly, for any practitioner out there, if you're a master's, if you're a practitioner, you have your own modality, that's fine. Make sure you get trained in it to the point enough where you feel you're competent and you know what you're doing, because that's important. Okay? If you are going to be charging people for your services, you need to know what you're doing and you need to be confidently able to tell another therapist, I know what I'm doing. So this is why I'm encouraging anybody to people to sign up, not for my training, of course, and for other trainings as well. But please, here's a tip: try not to sign up for too many trainings in a similar kind of mindset. So I have two. CTRT is a here and now, which is dealing with things which are happening now, issues that are happening now, which is why basic is appropriate for everybody and even for corporate. And the second one which I do is insight based, which is dealing with things that happen in the past. When the unconscious comes in, when issues of unconscious comes in, then I rely on insight based therapy. So I use, between these two modalities, I use techniques or tools from other therapies using the insight and philosophy of CTRT or insight based therapy. Now, that's really important. When you understand a modality deeper, you're looking at human nature. How do those modalities approach human nature? How do they approach philosophy? How do they understand how people work, and so that you can understand how your clients work and it helps you to do your therapy better? So please get trained. If you can, join my training, share, do all those nice things for the normal things that people say. Thank you very much. Thank you for listening. Dr. Nasuya signing off.